I am Dr. K. Shiva Raju, Senior Consultant Physician and Diabetologist working in KIMS Hospital for the last 17 years. I also have a clinic in Anandbagh, Malkajgiri. Today, we will try to have some idea, a glimpse about diabetes, because diabetes is such a burning issue. Even the younger people around 20 years, 25 years, they are affected with diabetes. If you see exactly what are the possible reasons for diabetes to happen, or we can see that there is no specific reason, but most of them we assume that family history is the main cause, but I don't think so. Lifestyle problems are also an important reason for predisposing to diabetes, like what we eat, our diet, our food habits. Nowadays we are eating a lot of caloric foods, we are getting directly into our home, and our physical activity, which is very less now. We don't have much time to do that. And then the stress levels because of our work, projects, office, and then sleeping patterns. The sleep habits have been changed a lot because most of the times we tend to sleep late nights, and because of all these important factors, the diabetes has become more and more common. If you see, all these are lifestyle related issues, and the younger generation around 20s and 30s, they are affected with diabetes, which is a scary thing and a pity thing as well. So we should take appropriate measures to prevent diabetes as well. And as you know, most of the times nowadays the diabetes is looking like asymptomatic, that doesn't have much symptoms. If you go and check the blood sugars, they are definitely high. The symptoms are usually excess thirst, weight loss, excess urination, and sometimes skin infections and genital infections. If you see diabetes, mainly 3 common types are there. Type 1 diabetes, where absolutely insulin is not there. Type 2 diabetes, where insulin is adequate, but because of the insulin resistant state, diabetes is occurring especially in the middle age group. And then gestational diabetes, especially in the pregnancy, which has become very common now because of the late pregnancies and then fertility issues. All these are contributing to that. So basically, to diagnose diabetes, we usually require fasting blood sugar and post lunch blood sugar 2 hours after food, or post breakfast blood sugar, and HbA1c, glycosylated hemoglobin, which we usually do. Try to see for the last 3-4 months sugar control, and glucose tolerance test. Glucose tolerance test, which is usually done to confirm whether into diabetes or not. So fasting blood sugars, if they are 120 milligrams, post lunch is around 140 plus, and HbA1c of more than 6.5 for 2 consecutive months, then the diagnosis of diabetes is made. And during pregnancy, gestational diabetes, the glucose tolerance test is done to confirm it. So by confirming this, we usually try to give treatment. The treatment modalities is not just only medication. The lifestyle modification in the form of diet control, low calories, high fiber diet without much sugars in the diet, and adequate protein should be there, and carbohydrates should be reduced. Simple sugar should cut down. Complex carbohydrate in the form of whole grains, oats, these things you have to take. And then you have to cut down the white sugar, white rice, and maida, these kind of things, so that your blood sugars will be under control. And then the physical activity, which is very important, at least half an hour to 45 minutes. If you can walk regularly, the insulin sensitivity will increase, and then the muscle strength will be better, and the blood glucose will be utilized by our body in a better way, especially in the muscles, fat, and liver, because of insulin. So insulin will be adequately, it will be sensitive and try to work properly. And then again, the stress levels has to be under control, because that also increases the hormones like cortisol, which are against this insulin, which increase the blood sugars. So diabetes, if you can see, it is not just about medication, it's about the diet control, it's about the physical activity that we do on regular basis. Stress level should be under control, and a proper sleep for at least 7 hours at least in the night, 7 hours is adequate. So these things, all these important measures will try to prevent diabetes. Another important condition is their pre-diabetic state. if you see most of the Indians, in millions, they are into pre-diabetic state. That means they are just maybe a short distance from getting diabetes. Fasting blood sugars will be around 100 to 120. Post lunch will be between 120 to 140. HbA1c between 5.8 to 6.5. So these are into pre-diabetic state. That means they have a high chance of getting diabetes in the future. If they don't take appropriate measures, lifestyle measures, then definitely they are going to get diabetes in your future. So please take care of this and please have a regular checkup, so that we'll have, whether you are a normal sugars you have a normal sugars, or you are a pre-diabetic or a diabetic, we can have an idea. So treatment depends on the blood sugar levels, and everybody need not require high doses or insulin. The main purpose of treating diabetes is what? If you see, the main treatment goal is to prevent complications of diabetes and to preserve the lifespan and to improve the quality of life. These things are most of the times are not understood properly by most of the people. So it is not just to control the sugars, because each 1% reduction in HbA1c will try to reduce the complications of diabetes, like diabetes eye problem, retinopathy, like nerve problem, neuropathy, then you have kidney problem, nephropathy. These are very common in diabetic patients. As the number of years increase, like 5 years, 10 years down the line, they are going to get these complications if the sugars are not under control. Lot of studies have done, they have shown that there is a direct link between the blood sugar control and the complications to occur. So please understand, the diabetic blood sugar, the diabetic management is not just to control the sugars. The importance is to control the sugars. It will have a long-term impact on the complications. The better the control the sugars, the better the HbA1c. If it is kept under 6.5 to 7 for most of the patients, then long-term complications will happen very, very less, and the quality of life will be very good at the same time, and you have a normal lifespan like others. That is the main treatment goal of diabetic management. And in elderly people, we should be cautious about the medication, and because they have a chance of low blood sugars, hypoglycemia, which is a common problem. So we have to use such a drugs where the sugar should not become low in these elderly patients, and we have to take care of, because they have a lot of other medical issues which usually cause problem. In diabetic patients, they have a higher tendency for heart diseases. 2 to 4 times they have heart attacks, more common when compared to normal persons. And if you understand, diabetic kidney disease is the most commonest complication secondary to diabetes, and is around 40 to 50% of diabetic patients may go on to diabetic kidney disease, and they may end up in dialysis as well. So I think type 2 diabetes is one of the major concern, not only in India, throughout the world, and we have to take appropriate measures to at least try to prevent diabetes, if not try to control the diabetes to prevent complications in the future. So I feel this is very important for all of us to understand, and especially the younger generation now, they are getting affected with the diabetes, which is not a good thing for all of us. So lifestyle modification should start at around 20 years of age. Our food habits, what we are eating, whether we are doing physical activity or not, whether our weight is under control or not. We can see a lot of people are obese patients, obese people. So they have insulin levels, but they will not, the insulin will not act properly. That is insulin resistance. PCOD problems are common in ladies, female problem, especially younger generation, which leads to fertility issue. Again, it's an insulin resistant state. So if you understand, I want to focus more on the younger generation, because they have a longer life, and if they have diabetes, they have to take medicines for almost lifelong. So try to understand and try to focus on these lifestyle modifications in the form of regular physical activity, food habits, what to eat, what not to eat. You should be very selective, high fiber, more of vegetables, fruits in a proper way, and try to do regular physical activity, have a proper sleep, and cut down the stress as far as possible in terms of meditation. You can do meditation, yoga, or regular physical activity to burn the calories and to have a proper insulin levels in the blood, and to act it properly. You have to do regular exercise, as I have told you, and then at the same time you have to have a proper sleep, which is very important for the body's repair. So I hope with lifestyle modification you can prevent diabetes by more than 50%. The study says, good number of studies. So I hope you have understood this, and try to do a regular, and if you are just crossing 20 years, try to have an idea about diabetes and the preventive measures that we have just discussed now, and try to check at regular intervals. Nobody is escaped from diabetes because it's so common. Family history is not the only thing. It is a lifestyle related risk factors that we have discussed.